Good morning. This is Dr. Bill White with the American Orthodontic Society, and I've shown you a video on the mechanics that we finally came up with for bringing in impacted teeth. And so I'm going to show a few cases where we use this mechanics to do this. And this young lady right here had a deviated suture line here, which turned to the side where she had a tooth missing over here, gone, and you'll see it curved around like this. And we get in there and work on it. We get it almost straight in there by expanding over on this side over here and working on it. She had a missing tooth here. This is just adult orthodontics, and it's something that the orthodontists ought to be teaching in the school. I feel that way. I don't know whether they feel that way at all or not, but I think this ought to be what they handle. So anyway, let's get on with this. I've got a lot of pictures on this young lady. A nice facial height. Everything looks good except it's, this height in here is excellent, and we're not going to change that at all. And we'll show you how the teeth. They're kind of messed up. The midlines off to the side. She's got chips in the ends of the teeth down here, and that probably comes from opening hairpins in that area. I've seen a good bit of that cases like that, and this is the side where we got all the trouble over here. This is pretty much class 1 over on the right side. Now here we go. The right, you can see it good. We've got a bad tooth back at the back there they have to fill. And here we've got a tooth out, and we've got another impacted tooth up in between the bicuspids there. This is a deviated septum again, and there's some duplications in the slides, and you can see the crowding in the lower anterior teeth right down here. You think you wouldn't have room for them, but when you get this opened up and open the bite up, there'll be room for those teeth. So here we are at 89, and we've got this impaction going over here, and you'll see the springs that we developed right here. This is one continuous spring to open this space. So this system actually provides a space to bring the tooth. It has a straight pull as to where you want the tooth to go, and it's got a spring tension in here, and it goes off a dental floss, which loses almost none of the force, pulling it to where you want it to go, and it's constant, and it doesn't have to be messed with the patient. Just don't tear it up. That's what we hope, and most people don't. I mean, this is looks complicated, but it's not that much. You'll go back and look at that video I've got on that completely. Now this side is okay here, and here this is. We've got a kind of a up bend in the arch to hold this space open right here, and we're pulling with this spring right up to this point. So this tooth, we're pulling it to this area right here, and this is a dental floss hooked on the spring with a certain amount of force on it. And you have to know how to measure the force with a Dontrix gauge. Now we'll go to the next. Here it is, looking from this side. You can see this floss going down this way, coming out. Now this is our own kind of hook. We twist 014 soft stainless steel bite, 014, and it's stout enough you can pull several pounds of force on it, and it won't stretch this out. And you bend this end in where they're not touching their tongue. When you make this before you go in and stick this in the mouth, and that's the best thing I've had come up with for hooking onto the tooth itself. Now, this is straightened out on the bottom. It's lined up pretty good. This is another view of actually adding a little more pull to it. We put a hook down here and put a rubber band on it, and the rubber band goes up and hooks on the same hook. So as this deal here is pulling it this direction, the rubber band is pulling it down more. You can add that to the other mechanics that we didn't show much about in the other video. All right, that's pulling from the side, and you get a view where we go it up here to hold this gap open while we work on this. Now this spring is pushing on the side of the tooth, and it kind of rolls like that, and so you have to rotate it back as it gets into place there. Now here's another view of it. I think we've got more views than we need, and that's pulling down with that rubber band. They can open that wide. Of course, the rubber band puts a different pull on it from the other, and it's kind of the arch looks lopsided over here. It's deeper, but as we finish this up, you'll see this level out right there, and it does it without doing anything much to it. Okay, again, there's the deal. Another view of it. I'm going to move pretty fast. If you want to study these, you can go slow with them. That's the dental floss. Now we've got up to a certain point here, and we took this hook off, and you can go down then and hook to this little bracket with the floss, and that's good. Like if you run up here and your hook run to the wire, looks like we could have pulled it a little further in here before you do that. Now this bracket is on the wrong side of the tooth, but you go down there and you're finding them, and they're buried in the gum down there. You just hook on them where you can see the point of the tooth. It needs to be on the point. And here we've pulled it all the way up to the gap now, and the tooth is going to have to be rotated completely around here. And this was the hook that we hooked it, twisted that wire on there, and got this cuspid up in this position now. That we'll put something else on it here to rotate it, and we rotate it around. Let me get back again. Okay, we turn it around and hook it up, and it's got some inflammation on this. You need to keep that cleaned out and taken care of. We're straightening these up, and we'll bring this now get that tooth straight, and you look at it and you don't even can't think that it was crooked. Anyway, we pulled it in from way up. All right, that's a bad picture there. Now the lingual side of the tooth is not doing as good as we would like it. We may torque this in some and help close this gap over it, but you'd have to clean that. That looks like that's too much torque, and you need to put some negative torque on that cuspid. And this bottom side's finished up. The cuspid looks a little better now, and we've got the root brought out some on the labial side. And this side's fine. There it is. We're finishing up with it now. And the nasal sutures in here, the center of this that we separated in palatal separator, that were curved over in this way, are straightened out now. Now that over a period of years. This is 1990. I think this turns back a little bit up there, but there's the tooth end. But we need to keep working on the root structure. That's a good point to send them to a periodontist, have that cleaned off and everything. Okay, let's see. I think I had some deals on that. Now here we'll go through the video, the cephalometric pictures, and this is the first one. You see this tooth was right up in here. Here's a retained baby tooth in there. So we're going to take that deciduous tooth out and then open a gap over it like that, and there we make the little hook. We're going to go in and hook it here, but it happens to be on the lingual side of this, and we'll tug on this and pull this tooth down in that direction, and we have to pull it over the roots of that lateral there. So we put the expansion in here and try to push this apart, try to get this root over to that side if possible, and you can put a little tip in that wire, like going up like that, and you cross that bracket and bring this root this way. I don't think we actually did that, but you could. And so now the cuspid is right over the tip, and it would have been better if we had to put a little bit of this tip in it, you see, and made this root move over, kind of bunched them up for the time being, then brought this down in there. Anyway, that's something we could have done better on this tooth. Now there's the tooth again. That's a pure x-ray, but it's the only one we had here, and it's coming up past that tooth, and here the tooth is down in place, and we rotate it from there, and that's it lined up, and here we are with it finished. This is 1990. We need to trim off a little bit here. That'll make this look less, but I'd rather somebody fill those corners like that if I could. Now let's see. We saved this space. It was going to be bridged. It wasn't going to have an implant, or we would have to open it up bigger or keep it bigger if we're going to put an implant in there. But she didn't want an implant. We're just going to put a bridge in it at this time. So the space is slightly less than it was to start with. Now on the retainer, we put a little an acrylic tooth in there to hold the gap open and be chewing with the retainer in there. And you hold that there until they get their bridge, and then you take this off and kind of adapt this to the bridge that's there. And these are the things that happen in adult orthodontics. And here the lady is, and this is the finished picture that I have of her. And she's a nice looking lady, and now the teeth look much better. So I want to say goodbye and thank you for watching, and hope you pick up something from this. I'm going to show several more cases of impacted teeth being brought in, and I'm going to stop this.